They are conditions that have no identified cause and leave millions of women silently persevering through intense pain.
Because health matters, Sincerity Council takes a look at fibroid endometriosis solution doctors found for one patient.
On the tennis court or in the courtroom, Little Rock lawyer Victoria Lee studies every move. But 2 years ago, intensifying periods changed her focus.
Extremely heavy bleeding and extremely painful. So where's the pain medicine? I was having to make all types of modifications in my life.
You do very detailed research as a lawyer, go to very specific sources. But when it came to something as important as your own health, you went to Google. Google.
Yeah.
That led to months of Lee drinking green tea, trying to heal herself from something that affects up to 70% of women in their reproductive years, fibroids.
A fibroid is just an overgrowth of a smooth muscle cell that just replicates out of control, and so it grows at a different rate for every person, and each fibroid may grow at a different rate as well. This is another fibroid.
You're looking at what was once out of control inside Victoria Lee's body. Surgeon Julia Goodwin, a physician who practices at Baptist Health, used a Vinci robot to attack fibroid after pain-inducing fibroid. Lee's case also presented other complications.
She had the enlarged uterus, but then she had endometriosis all underneath that was causing the uterus to essentially stick to the bowel.
Endometriosis is a condition in which the lining of the uterus grows outside of it. Luckily, Dr. Goodwin was able to cut all of Lee's problems away from her bowel without impacting it.
We're using really small instruments that can move very, very precisely.
Despite the successes to be had, millions of smart women like Lee are suffering silently. Why?
I think a lot of times women are taught not to complain, and so they don't want to.
Shifting that narrative, Lee's choice to speak out is already leading other women, like her big sis, to surgery for what they thought they'd just have to live with.
It makes my heart smile really big to know that that she's about to get the same relief and freedom that I now feel.
That was Sincerity Council reporting. Some women might not want to have fibroid surgery because they believe it always comes along with a hysterectomy, but that is not the case. A conversation with your doctor can clarify the options, but do know this: fibroids can reoccur after surgery if the uterus remains. We'll be right back.